So you spend a long time studying anatomy and physiology. The question I always have is this: for all the effort you put in, when you come to me for patient-centered teaching, how come I have to reteach it? How does that make sense, right? Like I'll come in and if I'm doing a course and I have to teach, I always start with heart. Everyone loves a pump. And then I'll give you shortness of breath. And then I'll start talking about why in congestive heart failure do we get shortness of breath. And you can't talk about disease if you can't talk about the structure of the organ and its function. You just can't. If you're new here, make sure to subscribe. I post a new video every week to help you learn better, prepare for your exams better, understand your patients better, and be able to do your stylized patients better because they always work perfectly. I'm Dr. Philip Tisdall. I practiced for decades. I've been teaching for over 10 years, and I became increasingly frustrated with the way medical schools taught. And so I was forced to develop my own way of teaching, which is patient-centered clinical pathologic correlation, or CPC. Today, I'm going to show you how using patient-centered learning for structure function is a much better way of doing it than your standard subject teaching. Let's talk about the words. I use the word structure, which you could substitute anatomy, except we've all done anatomy, and so we all have this sense of what anatomy means. So I wanted to pick a word that no one has any emotional response to. So when I say structure, you can say anatomy, but it's more than that. When you go say, how did you learn anatomy? I just hope you didn't have a cadaver. I can only tell you we did because there were no plastic models. This is 1972. I'll just let you do the math and compare that to your parents' age. All we had was the body. I can just promise you, those fixed bodies, they don't smell right, they don't feel right, and they don't teach you the right things. Did you start with the musculoskeletal system? You just don't use it much in clinical medicine. It's not where you think about disease. And so you get this totally skewed idea in which you take 20 feet of bowel and remove it, not understanding you're going to spend months thinking about that 20 feet of bowel, and yet you spent zero time on it. How much time did you spend dissecting the back? It's just not the right way for patient-centered learning. So what that means is, first of all, no cadavers. Second of all, we did autopsies. We were all at surgery. We handled human tissue. We felt human tissue. We saw pus. You guys it's a different education for you guys. You're not on the floors. You're mostly in rooms. And so what that means is we've got to talk about how you're going to see disease in your generation. You're going to do structure by anatomy and by imaging. So, you should be given an ultrasound and you should be taught to understand your anatomy through ultrasound. There's no other way to do it. So think what we're saying now. When I say structure and I mean anatomy, let's just start with gross anatomy. You've got to do this idea of completeness, of which there's an earlier video. Please watch it. It goes from regional to surface organ to internal structure of organ to architecture to cell to ultrastructure to protein to DNA. No gaps. Okay, if you're being taught by a clinician, she will be great from patient to organ. If you're being taught by a PhD, they are traditionally great from DNA up to ultrastructure. Kind of an ugly gap there, isn't there? So when I say it's a disease of hepatocytes and you have no histology because all of your anatomy was gross anatomy on things that doctors don't talk a lot about, think subsegments of lung, you don't have anything but words. You can think in cells. When I say hepatocyte, do you think radiator? Because if you haven't arranged them in plates that look like a circular radiator and you don't have a sinusoidal capillary, you don't understand liver. So when I say structure, I expect you to be able to say liver, right upper quadrant, Glisson's capsule, internal structure, doesn't matter. There isn't any, it's all the same. Straight to architecture. Can you do sinusoidal capillaries? Can you do plates of normal microvilli cells? Because if you can't, you don't understand liver. And then when I say ultrastructure, can you do the smooth endoplasmic reticulum? And when I say alpha-1 antitrypsin, now I'm going from protein to ultrastructure, can you see that misfolding means it can't get out of the smooth endoplasmic reticulum so you can just literally see it? So when I say alpha-1 antitrypsin, do you have a picture of that hepatocyte? Do you have a picture of the SER? Do you have a picture of that blob of protein there? Because if you don't, it's just words, and words are gone in a month. So when I say structure function, I say structure is this clear mental picture so that no matter what disease we're talking about, you've got a reference. Function is the same thing. Think about how you were taught lung phys. I just happen to be teaching at a school that's going through lung phys, so I'm thinking about that. I struggled over that forever. Oh, vital capacity, total lung capacity, reserve volume. I faithfully memorized it and just as easily forgot it. And it was only when I came to teach that I realized, I'm not kidding, this is pulmonary function testing. Are you watching? Yeah, that's it. That's the whole thing. If you take a look at what I did and form a mental picture, right? Here's what I did. The amount that I pushed out, that's just your forced vital capacity. I mean, is that just the most obvious idea in the world? The next thing is watch this. Watch how fast the air goes. Did I get 80% of that out in 1 second? Yeah, that's it. So, I'm going to be teaching lung tomorrow to some first years, and I only get 45 minutes. And I'm going to say to them, if you can do function and you're doing lung, all you're going to ask yourself is 2 questions. And that will divide your lung into obstructive, restrictive, and everything will work perfectly. But if you do all those squiggly lines and all those definitions and you struggle with them like I did, and then you come to lung and you're useless, it's because you're not doing a patient-centered way of seeing structure function. Think about what I just said for function, right? Yeah, that's ventilation. So what do I need for gas exchange? Have you got a picture of the alveolus? I mean, a real picture. If I gave you a piece of paper, could you draw it out? Because if you can't draw it, you don't know it. You just have words. So you can imagine my frustration teaching a bunch of students, none of whom have any histology, even though they've had histology courses. None of them have physiology that's in their mind. They're all pieces of paper with squiggles on them. You can imagine when we come and say, hey, so I've got a patient that's short of breath. Tell me what the stethoscope's going to tell you to break it into ventilation gas exchange. Well, I have to teach that. But you guys did endless months on structure function in lung. Why am I reteaching it? Because you weren't teaching patient-centered ClinPath correlation ways of saying, what do doctors use? When you're learning something, what do you always say? Why do I care? And when the PhD goes, well, this is really important, you go, hey, here's the meme, #MakeMeCare. And so I have a rule in no one's ever claimed it, but I do have a rule when I lecture. You can put up your hand and say, why am I learning this? And if I can't immediately tell you where I use it in patient care, I never teach it again. So when I say structure function, you can imagine my frustration, right? You guys don't have it when I come to teach. I have to reteach it. So I got tired of repeating myself, and I wrote it in the book. So every system you come to, it starts with a CPC. Guess what chapter 2 is in heart? Yep, structure function. Guess what chapter 2 is in kidney? Yep, structure function. So it's structure function that I can teach disease and pharmacology on. And so what you're learning isn't wrong. It's just for you because you haven't done a lot of patient care. You don't know why you're learning it. So come and learn what you got to do to pass your exams in school, but please come and read structure function so I don't have to reteach it when we get into disease. Let's talk about now why you just can't have the book. You need a teacher. One of the things I've really learned over my years and years of teaching is that anything that's really hard requires intense small group tutoring. And medicine is hard. You really need to work with students and let them ask questions and bounce it back off you and go, tell me how you think about that. Oh, yeah, let me show you a better way of thinking about that. You really need that kind of teaching because every organ is different. You notice how when I said liver, I sneered at internal structure? Because the liver is just one homogeneous blob wrapped in Glisson's capsule. Yeah, if anything drives me crazy, it's people that feel you have to know internal anatomy of the lung. I get it. You can do the lobes. Lobes are marginally okay because you can sort of see them on X-ray. But the idea you're learning the subsegments, I did nuclear medicine for many years, and so we did the old days of VQ scans for pulmonary emboli. After 10 years of doing those, I still had to have a picture of the subsegments of lung to know what I was looking at on the scan. I just don't think it's possible to learn them. Maybe there's some genius somewhere. That genius isn't me. It never affected anything. I just sort of knew it was lobe or smaller than a lobe, so it's probably segmental. Why would you teach that? There's lots to learn. Just don't. So every organ system is different, and you need a medical educator to tell you, how do I think about? So I need you to know architecture and individual histology of liver. Don't need any gross anatomy or internal structure. Heart, totally need internal structure. Everything's going to be short axis, long axis on echo. Can you see heart with those two planes? Because if you can't, I'm kind of stuck teaching you. I'm going to have to stop and reteach it, which I always do. When you come to kidney, can you really see where the nephron is? Can you do a pyramid and put the nephron on it? Because I kind of need that when I come to teach you. Nephron is everything in kidney, and then each segment's a little story. Can you do that? If I gave you a piece of paper, could you draw a nephron and tell me what each story does? Because you know what I'm going to do at the end of that? I'm going to put every disease, every test, and every drug on it. So how the heck am I going to teach you clinical medicine if you don't have a good structural view of the nephron and its histology? Well, I can't. So guess who ends up teaching it in every course? You know, the one thing I can't do, because I was so over-taught it, I memorized and then immediately forgot it. I'm really poor at neuroanatomy. Man, I memorized all those little pathways, passed my exams, and a month later I had nothing. You know, I think if I was learning neuroanatomy, all I would do is the physical exam. If you can do a neurologic exam and tell me, draw the pathway you just tested, I mean, that's the way to do it. Not by me yet. I've got to teach myself that, but I will. So when I say structure function, you can see how it's not just a question of from region to protein. You've got to know how you use it and what's important for this particular system. So structure function, you get the idea. The particulars matter. Always and ever we come back to, that's great, but I have to pass my exams. You're completely correct. So how does this help me in exams? Because if you don't have a picture of something, you've only got words. And remember, the STEP is a really good exam, really thoughtful exam that says, do you know how to use basic sciences in your patient care? So you can imagine someone like me writing a question going, okay, so you got to think about the liver as sinusoidal. I'm going to ask you a question that's based on the idea that you have that mental image. So if I'm saying to you, let's start with alcoholic cirrhosis and let's start with the stellate cell, I'm going to design a question that says, can you place that in the space of Diess where my initial fibrosis starts? Boy, pretty tough to do by words, isn't it? Truly simple if you've got the picture of the hepatocyte, space of Diess, and the sinusoidal capillary. That's just an obvious way of talking about cirrhosis. So yes, this is fundamentally the way you can pass an exam that's testing you on why you learned your basic sciences. If you want to dive deeper into structure function and you want to know how to do it for each organ system, you're going to need the textbook. And you can get that by clicking on the link in the description. Next week, I'm going to be talking about what you don't have to learn. Easily the hardest challenge for everyone who's teaching students. I'll see you next time.